To get caught up on the latest overnight with West Virginia reporting its first case of the coronavirus. It has now reached all 50 states. In total, there are more than 6,200 cases and at least 111 deaths from coast to coast. As you can see, that is a significant increase in recent weeks. We had some breaking news in Chicago overnight. The tower at Midway Airport temporarily closed, flights grounded after several FAA workers tested positive. And this morning, the White House is pushing a huge stimulus package to the tune of $1 trillion to boost the hard-hit economy. We do have complete coverage from cities from coast to coast as they go to extreme lengths to slow the spread of this virus. We'll start with NBC's Gabe Gutierrez, who joins us now with the latest. Hey, Gabe, good morning.
Hoda, good morning. Many iconic landmarks have already shut down, including the Statue of Liberty. Macy's has already closed all of its retail stores across the country, including its flagship behind me. And now we're getting mixed signals from the governor and the mayor here on whether New York City will order its more than 8 million residents to shelter in place. From the city that never sleeps, now on the verge of complete silence, to casinos closing temporarily along the Vegas Strip, to schools, shopping centers, and businesses empty coast to coast. Much of the U.S. is now staying home. New York City's mayor says a decision to shelter in place could come within the next 48 hours.
I think New Yorkers should be prepared for the possibility of a shelter in place order.
Many bars and restaurants here are devastated, no longer allowed to let customers dine in.
Is it sustainable to just fulfill takeout and delivery orders?
No.
What's your message to President Trump?
We need help now. Now. They're choking us slowly and taking the air out of us.
Parents across the country are also increasingly stressed out. California's governor says schools in Los Angeles could be closed for months.
It's unlikely that many of these schools, few if any, will open before the summer break.
Small businesses in Austin, Texas, already reeling from the cancellation of the city's massive South by Southwest festival, are facing new restrictions.
The service industry is devalued so much, but we will know in the next couple of months how important we are to, again, quality of life.
Florida's governor refusing to shut down the state's beaches, which are packed with spring break tourists. The most drastic steps so far are in the San Francisco Bay Area. A sweeping shelter-in-place order is keeping 7 million people home for the next 3 weeks. But one area of American life still in play in some states Tuesday, voting.
I think it's my duty as an American to come out and do my patriotic duty.
Amid poll workers cleaning, primary voters mark their ballots in Florida, Illinois, and Arizona. A striking scene amid empty streets. The virus is really reshaping American politics. Joe Biden swept the primaries in those 3 states, but Ohio postponed its voting due to health concerns. Back here in New York, the governor expects infections will peak in about 45 days. Savannah.
All right, Gabe Gutierrez leading us off. Thank you. Meanwhile, there is great concern this morning about the effects this pandemic is already having on families and businesses. The White House now talking about massive government action to shore up the economy, including perhaps a check to every American. NBC's Tom Costello also working from home this morning. Hi, Tom. Good morning to you.
Savannah, good morning. Yeah, hotel chains are now furloughing employees. We've seen businesses, small businesses, big and large. We've also seen retail outlets closing down for now, gyms and restaurants and bars. All of those people unable to work right now without a pay. And now we're watching the government talking about this massive financial injection, the potential for a $1,000 check to every American.
With many Americans temporarily off the job and the stock market on a roller coaster ride, the White House is pitching a massive stimulus plan that would inject $1 trillion into the economy. A quarter of that would go directly to the American public.
Americans need cash now, and the president wants to get cash now. And I mean now, in the next 2 weeks.
So far, few details on how it would work. But Mnuchin says the relief would not be for the wealthy.
We don't need to send people who make $1 million a year checks, okay?
Also in the White House stimulus proposal, assistance for small businesses and relief for the airline industry.
We don't want airlines going out of business. We don't want people losing their job.
At the other end of Pennsylvania Avenue, the Senate has yet to vote on a coronavirus relief bill passed by the House. That measure, which has support from the president, would provide up to 10 days of paid leave for some workers and free coronavirus testing for anyone whose doctor says it's necessary. Speaking from a freshly disinfected podium, Senate Majority Leader Mitch McConnell.
My counsel to him is to gag and vote for it anyway.
McConnell telling reporters he'll urge his Republican members, including those who disapprove of certain parts of the bill, to prove they can work in a bipartisan manner.
This is not an ordinary situation, and so it requires extraordinary measures.
Meanwhile, with tax day fast approaching, the government is trying to ease the burden, pushing back the April 15th deadline by 90 days. And even with the recent wild swings on Wall Street, the head of the New York Stock Exchange says now is not the time to panic.
We will get through this, and so trying to react to these major market moves right now in their 401ks is probably not the wisest move.
It all comes as coronavirus testing is ramping up across the country, including drive-through sites in many states. But the wait can be long. This backup in Birmingham, Alabama, stretching all the way down the highway.
Your travel history to a country with an outbreak of the coronavirus disease.
And with stricter screening guidelines now in place for travelers flying into the U.S., the European Union is rolling out its own restrictions to stop the spread, implementing a 30-day ban for most external travel.
We've talked a lot about social distancing. Experts say it's the best way to kind of slow the spread of the virus. And specifically, the American Hospital Association says we've got to do whatever we can now to hopefully preserve ICU beds, as well as all of the ventilators that are going to be needed and protective gear. But even with these measures, Johns Hopkins says, listen, we may not see any impact on the data for a week to 10 days. And then you don't know what you don't know. So you've got to keep trying and try to keep this virus in check. Savannah, back to you.
All right, Tom Costello, thank you. And we are joined now by the nation's top doctor, the U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, good morning to you, sir.
Good morning, Savannah. How are you feeling?
I'm feeling well enough. Thank you for your kindness in asking. I want to ask you, do you feel like people are getting the message here? You know, we still see people out and about. You had 3 states holding votes yesterday. Do you think people are sensing the urgency?
Well, I think we're starting to turn a corner, and people really are. It's because it's starting to affect people who they see and know. I have a 15 and a 14-year-old son at home, and they don't care what Dad says, even if Dad is the Surgeon General of the United States. But by golly, they know that Kevin Durant just got diagnosed with the coronavirus, and they're taking it seriously. And you're modeling the behavior that we want people to model. We want them to understand that, look, chances are you don't have coronavirus. Chances are, if you do have it, you will recover. Based on the Korea data, 99.3% of people recover. But what we don't want to do is have you or anyone else out there spreading it to people who are at higher risk.
Absolutely. These new CDC guidelines that were announced this week say advise no gatherings of more than 10 people for the next 15 days. You've said we can do anything for 15 days, but give it to us straight. Isn't this going to be longer than 15 days? How long do you think people should expect to be at home, essentially?
Well, what you're talking about is our 15 Days to Stop the Spread initiative. We're telling people that we really want them to avoid gatherings of 10 or more. We want them to avoid any unnecessary travel. We want them to work from home if at all possible, or not go in. And the reason why we framed it this way is because when we look at the data, our numbers are where Italy's were 2 to 3 weeks ago. So we really have a choice to make right now as a nation. Do we want to go the way of Italy and see our numbers increase rapidly? Or do we want to go the way of South Korea and China, who aggressively leaned in the mitigation measures and were actually able to level off their peak and are now seeing significantly decreased numbers of cases? We really feel like if we can get America to all pitch in.
Yeah.
We feel like if we can get America to all pitch in for the next 15 days, we can flatten the curve, which is a term that you've been hearing a lot, not overwhelm our healthcare systems.
So
and
15 days is enough?
15 days is likely not going to be enough to get us all the way through, but we really need to lean into it now so that we can bend the curve in the next 15 days. And at that point, we'll reassess.
Okay. Okay, let me ask you about a new study. It was published just yesterday in the New England Journal of Medicine, and it found that the virus is somewhat airborne, that it can stay suspended in the air for up to a half hour before descending and settling on surfaces. I don't have to tell you this is different than what the World Health Organization has said, that it's not transported through the air. What's your best information on that issue?
Well, this is a new virus, and we're learning more about it every day. I talk to Tony Fauci multiple times a day, and he and Dr. Birx and the best virologist in the world still believe the primary mode of transmission for coronavirus is by droplet, which means, again, social distancing is going to be the most effective thing you can do. When you talk about surfaces, that's why we really emphasize the importance of washing your hands and constantly cleaning surfaces. If we do those three things, making sure we're cleaning our surfaces, making sure we're washing our hands, and making sure we're staying 6 feet away from people, that's how we will most protect ourselves from this disease.
Dr. Adams, let's talk about testing. I don't think there's much dispute that the CDC was slow to get testing going, that there have been delays. I mean, even now we see lines, people trying to get the test, even though they're more widespread now. We still have only tested 59,000 people in the entire country when South Korea was doing 10,000 per day. The question is, what is the status now of testing? Are there enough tests out there, and are they being processed in a timely manner?
Well, a fair question, Savannah, and I really feel like we've turned the corner on testing this week. It's important for people to know the CDC stood up a test for this in a week, but the CDC was never equipped, staffed, or intended to provide testing for hundreds of millions of people. We were always going to rely on the commercial market and the private industry, and now with the FDA approval or emergency use authorization for a high-speed test last week, you're seeing testing increase. And what American people really care about is, can I get a test in my community? You're starting to see that. The small rural community where I grew up in offered drive-through testing this week. We're starting to see more and more people get testing. But here's the important point. You should not change your approach to mitigation measures based on a positive or a negative test. You could test negative and still be early in the incubation period and still spread coronavirus. So if you're sick, just like you did, stay at home. We should be acting as if we have the virus, as Tony Fauci says, so that we can protect one another.
Real quickly, because I'm almost out of time, but I do want to drill down. The big question and the whole reason we're trying to flatten the curve and slow this down is so that our healthcare system can manage the patients who do come in and are very sick. Are you confident we have enough respirators and ventilators to help patients and protect our frontline healthcare workers?
Great question. When you look at modeling, again, you've got curves that look like Italy and curves that look like South Korea. The best way to not run out of ventilators or PPE is to make sure you drive down demand so you don't need them. And that's why, again, we're leaning into the next 15 days. Now, I want Americans to know we have a national strategic stockpile. We're working with public and private partnerships to increase production, but that's on the supply side. If our curve goes the way of Italy, and there is every chance that we could run out of devices, and that's why it's so important that we lean into these mitigation efforts now, drive down demand, flatten that curve.
Some have suggested invoking the Defense Production Act right now to ramp up production of ventilators and respirators and this equipment just to make sure. Maybe we'll never get there, but wouldn't we rather be prepared now?
Well, everything is on the table, and the president and the vice president have been in contact with industry on a daily basis, trying to ramp up that production. Right now, as Surgeon General, my job is to talk to the American people, and what the American people can do is really drive down that demand by staying at home, washing your hands, social distancing.
Dr. Adams, I got the message. Thank you so much for being with us this morning. We really appreciate it. I know it's a busy time.
Thank you. Another important point, you can still go out and give blood. We're worried about potential blood shortages in the future. Social distancing does not have to mean social disengagement.
Yeah, I'm glad you mentioned that. A lot. We definitely want to make sure they still have the supplies they need. Thank you, sir. Appreciate it.
Thank you. And feel
better. Over to you.
All right, Savannah. Here to help us dig a little deeper into all the morning's developments, Dr. John Torres, our medical correspondent, and of course, NBC senior business correspondent Stephanie Ruhle. Let's pick up where the Surgeon General left off. We were talking about masks and respirators. I couldn't help but notice trending on Twitter was "Get me PPE." Those are nurses and doctors basically saying, "Get me personal protective equipment." The anecdotal stories of people having a single mask that they are spraying with Lysol seems ridiculous. So the question is, it doesn't sound like there are enough masks. What should we be doing?
And especially in the United States, you think we have this big manufacturing capacity. I think in most of the country, not an issue, but there's those hot spots where it's definitely going to become an issue, and it's starting to become an issue. You get those anecdotal reports of it. I can tell you as a doctor, if you don't have the equipment, or as a nurse or as a tech, you're making a decision to walk in that room, and you're trying to say to yourself, you know, if I walk in that room, there's a potential I could get contaminated, my family could get contaminated. You go ahead and do that anyway, but that's in the back of your mind the whole time, and you have to make these tough decisions on what to do at that point. Not something we should be doing. We should have those masks. And I know yesterday they said, hey, construction companies donate your N95s.
Yeah.
I think that's going to help a little bit, kind of a drop in the bucket, but it will help. But we need to get those manufactured.
You just think that someone, would get up and start making them. All right, so the number of cases was pretty shocking. We gave the numbers this morning. For 1,000 cases, we went from 1,000 to 6,000, a 500% increase. Is that shocking to you, or did you expect that number?
I don't know if you remember last week, I talked about it, and somebody asked me, what number would surprise you? If we went to 10,000 over 2 weeks, would that surprise you? And I said, no, it wouldn't surprise me, because we're starting to test more. What's surprising me a little bit are the number of deaths that are accelerating, because that has nothing to do with the tests. So the deaths are going up too. And so I think we're seeing two things. It's spreading more and we're testing more. So we definitely need to get a better handle on it.
Let's talk money. Secretary Mnuchin went on TV and said $1 trillion. Huge number. I bet you people thought to themselves, okay, the question is when do you think people are going to get money in their hands?
Well, listen, Secretary Mnuchin has said, I want people to get a check in 2 weeks. And you're actually seeing widespread support from Democrats, from Republicans, but also from medical experts. And here's why. If you are living paycheck to paycheck, and let's say you're not super sick, let's say you're Savannah, you just have a sore throat, and the option is, should I go to work and get a paycheck and feed my family, or stay home and be extra cautious? The right thing to do to flatten the curve is be extra cautious. But if it's about feeding your family or not, you're going to go to work. So getting that $1,000 check will matter. The big question is, how many $1,000 checks? We don't know how long this will last. So it's not like it's a finite number. This is open-ended.